Lebanon, to the capital Beirut. We're going to speak to Dr. Shadi Saleh, founding director of the Global Health Institute and professor of health systems and financing at the American University of Beirut. Welcome to the programme.
Thank
What
you.
is the situation where you are at the moment in Beirut? We were hearing from a guest earlier on that there's not been an Israeli airstrike in Beirut for a couple of days.
So it's for me, I'm not going to go into the military stuff. I'm going to talk more about the healthcare system,
No,
which
but
is my.
absolutely. But I was asking you what you, as a citizen, looking out of your window, are seeing and hearing, and when you're out and about in Beirut.
It's again, it's not about being a citizen. It's about having to live in a war where thousands of people have been killed, and where equally a healthcare system that has been suffering since 2019 from various issues, from the economic crisis, from the August 4th port explosion to the COVID-19, have to face yet another very dire situation in dealing with many casualties, unfortunate casualties of war.
What kind of injuries have you been treating in your hospital?
So, physicians and healthcare workers and healthcare organizations in Lebanon, most of those have been trauma cases for given reasons. Our medical center has played a pivotal role in most of these at the American University Medical Center, but still there are hospitals all over Lebanon that have to deal with this. And again, it's a double whammy, as they say, because one, these are physicians, nurses, and healthcare professionals. They themselves and their families have to deal with the atrocities of war, and yet at the same time serve their people and put themselves at risk, because as you know that quite a bit of those hospitals, or at least the areas in which they operate, are themselves being targeted. And we had a very interesting discussion yesterday as part of the World Health Summit that is going on in Berlin as we speak, and I couldn't attend in person. But we had a panel where we highlighted that the issues of attacks on healthcare workers or healthcare facilities, wherever that happens in the world, is utterly unacceptable. And I suggested that a special tribunal on attacks on healthcare facilities and workers should be held all the way up to being classified as a war crime in case those who commit this are convicted. And again, I'm not talking about this specific situation. I'm talking about wherever that happens in the world.
You mentioned before the
Healthcare
port
should not be.
explosion, and we know that Lebanon has been in a terrible economic situation for a number of years now. So was the healthcare system in the country crumbling or broken before the conflict really erupted a few weeks ago?
So the healthcare system in Lebanon has survived quite a bit of events since the civil war in 1975 that ended in 1990. And I wouldn't say that it was crumbling, because the individual determination of the Lebanese people, the Lebanese organization, is quite outstanding. But I would say that it was already under quite a bit of pressure in the past 5 years, and with this, what has happened with the war, it just made things significantly worse.
What kind of help then does your hospital, do other medical centres in the country need?
So first of all hospitals, and I'm not speaking about our medical center per se, the healthcare system in general in Lebanon is in need of support, whether that is infrastructural support, whether that is supplies, whether that is support for healthcare personnel. And I'm happy to report that quite a bit of countries and UN agencies, starting with many Arab countries, whether it's the United Arab Emirates, Saudi Arabia, Qatar, Egypt, and others have been supporting in the previous weeks, as well as many UN organizations. But the hope is that the international community as a whole would be more proactive in supporting the healthcare system as well.
Thank you, Dr. Shadi Saleh there, founding director of the Global Health Institute, joining us from Beirut.